Ladies and gentlemen, please welcome our panelists. Chairman, Global Alliance for Improved Nutrition, Jay Naidu. President and CEO, Save the Children, Carolyn S. Miles. Chief Executive Officer, Discovery Education, Discovery Communications Incorporated, Bill Goodwin. And our moderator, Deputy Executive Director, UNICEF, Geeta Rao Gupta.
Thank you. Thank you all for joining us. Good afternoon to all of you. The story of child survival over the past 2 decades is one of significant progress. It's one of our success stories in the field of international development. There are many more children surviving today than ever before. Yet we have a long way to go. We have 19,000 children still dying each year. Recent data that was released by UNICEF and other UN agencies, WHO and others, pointed out that the global number of under 5 deaths fell from around 12 million in 1990 to approximately 6.9 million in 2011. So there are many more children now celebrating their 5th birthday, and that's good news. But we don't want children just to survive. We want them to thrive. We want to see them grow through investments in their physical health and nutrition, their cognitive, intellectual, and emotional development and well-being, especially during the early years of childhood, from birth to the time that the child is 5 years of age. The investments made during this critical window of childhood sets the trajectory for growth right into adulthood. So it sets the foundation for a healthy and productive adulthood, which means that it's not just the moral thing to do, it is the smart thing to do. Consider this, and this is just one example. Chronic malnutrition in the early years can permanently limit the physical growth potential of tens of millions of children around the world. It does do that. And the consequences of capping their physical growth, what's called stunting, goes quite beyond height. During the first 1,000 days of a child's life, from pregnancy to the age of 2, nutrition fuels billions of cells in a child's brain, wiring it for cognitive growth and development in the years to come. So chronic malnutrition then limits brain size and connectivity, costing the child between 2 to 3 years of learning. The consequences, unfortunately, of stunting are irreversible. When stunted children enter the workforce as adults, their earning capacity, it is estimated, is 22% less than that of their peers. These facts are particularly noteworthy because in most countries in South Asia and Sub-Saharan Africa, the range of stunting goes anywhere between 20 to 47% of all children, which is a great cost to the livelihoods and well-being of families and generations to come. There is no treatment for stunting. It is irreversible, but there is prevention. And we know what the prevention methods are. Exclusive breastfeeding for 6 months, first 6 months, proper hygiene, good health, community nutrition programs can all prevent stunting at very little cost. But that is just one example of the disadvantage that results from weak investments in the early years of childhood. Just one of the costs of inaction. Today, we are here with this distinguished group of panelists to discuss the returns on investments in the early years. These are all individuals who have made powerful contributions to that particular period in childhood through their institutions. So let me begin by asking you, Carolyn, as the head of Save the Children, when you think of issues such as psychosocial development of children, and early childhood development, I think of that as being in the realm of psychology. Yet I know that Save the Children has made a strong case for this really being about economics. Can you tell us a little bit about that, about why this is a good economic investment?
Sure, Geeta, and thank you, and it's great to be here to talk about this. As I've been at Save the Children, I've become more and more convinced that this investment in the early years is absolutely the best investment we can make, and it really is about survival, and it's then about kids learning. You could think of it as kind of live and learn. That really is the message. And on the living part, as Geeta said, I think part of the reason it's such a great investment is we have a proven case here. Today, in this room, if we gathered all the children that are living today that wouldn't have been living in 1990, you'd have 14,000 kids under the age of 5 in this room. It'd be a little crowded. But that's the progress that's been made. We have not finished the job. We really do need to finish the job, and that's really what I think all of us are really pushing and advocating for. And it is very low-cost interventions in terms of the survival piece. It is the breastfeeding piece. It is reducing stunting. And part of the work that we've looked at is the impact of stunting, the impact of kids' brains actually not developing because they don't have proper nutrition in the first 2 years actually can add 2 to 3% to a country's GDP. So this issue of early nutrition is not just an issue of it's the right thing to do, and of course we should make sure that kids have the right food to eat. It's an economic issue. And we've actually done work along with lots of other partners to look at this impact of stunting and malnutrition in that critical from conception through to year 2. So there is really an economic argument. So after you're able to have kids survive, then there obviously is the need for kids to learn. So live and learn. And on the learning side, we've done a lot of work, again, with many partners and many governments to look at early childhood education. I think a lot of people think that early childhood education, preschool, is a luxury for developing countries. And I would tell you, it is not a luxury. It is a necessity. Because when you look at the impact of just 1 year of preschool on enrollment of kids in school. So we did some studies in Mozambique. 24% of primary school enrollment was increased by 24% when kids just had 1 year of preschool. So it has a huge impact. And obviously, that then has a large impact on, again, the economics of that country. These are very inexpensive interventions. In this Mozambique study, it's $2.50 per child per month. Okay, so what's that? $30 a year to have kids in preschool. And the impact of that is really enormous on a country's GDP.
Thank you for that. So have countries recognized the value of this investment? Are there a lot of countries who are making an investment in preschool, for example?
They're starting to. I mean, we're having a lot more countries. Again, it's you get a policy. First of all, there's lots of countries, as you know, that are talking about education for all. And that includes preschool, but actually getting that to happen at the country, the village level is the real challenge now.
So Bill, let me turn to you. Discovery Communications clearly sees early childhood as a great investment, as a great market. What made you decide to do that? Was it those kinds of arguments that made Discovery Communications focus its products on those early years?
Well, let me take a step back. And when we think about some of the major issues that affect the world and all of us, keep us up at night, you think about the economy, you think about peace, you think about health, and as Carolyn mentioned, in many cases, human survival, right? Well, there's one thing that can help to go to support solving all those issues, and that's education. And that's really what Discovery is about. It's education, whether it's about educating viewers all over the world in 200 countries, or whether it's about Discovery Education, which is primarily focused in K-12, getting kids excited and engaged about coming to school, transforming teaching and learning, so you increase student achievement. And then we also have our nonprofit partnership, Discovery Channel Global Education Partnership with Chevron and Coca-Cola. And what that's designed to do is use the power of technology, right, to transform and promote education in developing countries. So then if you take a step back in terms of early childhood development, just as Carolyn mentioned, that's when it's most critical, right? In the early years. We know the brain forms at its highest peak level to absorb information at age 3. And if you think about how kids are engaging technology today, right? There's a 3-year-old engaged with an iPad. You've got 2 to 5-year-olds, 25% of 2 to 5-year-olds in the US can open a web browser. 80% of kids in France can actually, use a computer mouse. So you can start at early ages. And the great thing about, I know we'll talk about this later, but the great thing about technology, it allows you to educate in masses in ways that human capital could never do. You can basically take and use technology if you have access, right? If you have broadband access, you can basically give parents tools and resources to educate, inspire, not only in the classroom, but also with parents. Healthy Weight Commitment Foundation is a perfect example. That's a coalition and consortium of hundreds of companies, right? Coca-Cola and Pepsi have come together on this. But it's all about giving parents and schools resources about nutrition and fighting obesity. So the whole point for us is it's all about education, and you've got to start at the earliest age.
Thank you. Jay, listening to Bill talk, I'm thinking of how technology, broadband, all of that access is more possible in the richer nations of the world. But I have heard that investments in early education are often described as the great equalizer, that it's sort of a powerful tool for equity. Would you agree? And if so, how is GAIN, the organization that you lead, using investments in nutrition to rectify inequities?
Thanks, Gita, and thank you to the audience here. I just want to demonstrate by an anecdote how far our learning has gone. In 1995, as a result of the work of billions of people around the world, including President Clinton, we won our freedom in South Africa. And a bunch of ex-prisoners, Nelson Mandela amongst them, and myself as an ex-trade union leader, walked into the seat of power, into government. I was his minister of Reconstruction and Development. And we had this, following, I suppose, developed countries, 100-day program. And I was responsible for it. And 2 of the interventions, one was free health care for pregnant mothers and children under 5, and the second was school feeding. Now, in those days, I thought that this was the most important nutrition intervention. But what we know today is, in fact, the first 1,000 days from conception to 2 years is the window of opportunity. And if you do not address nutrition in pregnant mothers and children under 2, you will miss the boat. And even if that family had to win the lotto, the damage that child has suffered, both from a mental, intellectual, and physical point of view, is irreversible. So I think our knowledge has now increased dramatically. And we must be able to use the science, because we know today, if you do not address undernutrition in those first 1,000 days, then the link is proven scientifically between undernutrition and obesity, bone diseases, cardiovascular, and hypertension, and diabetes, which are becoming epidemic in our world today. So we know that as a fact. Now the question is, how do we finance this? Well, the GAIN model, which really is about a public-private partnership set up at the UN Summit on Children in 2002, today operates across 30 countries, and its programs working with over 600 partners, mainly private sector companies, governments, and even NGOs, is looking at innovation. What is the innovation we need? And how can we make it financially sustainable? And now, if one had to take the point that Caroline was making about that first 1,000 days, if we improve breastfeeding, in South Africa, which is a more middle-income country, only 8% of mothers breastfeed. Then we know for children from 6 to 24 months, there needs to be adequate complementary food. For many of us in this audience, we can go into the local store and we have 100 choices to make. But when you're earning $2 a day, you cannot afford that. So in Bangladesh, as an example, where 80% of children and mothers are anemic and micronutrient deficient. We work with a local company. We invested into that company on a developmental return called Renata, a pharmaceutical company, and then with BRAC, which is a social business with 8 million members. And we created something called a sprinkle. It's a sachet, almost like a sugar sachet. It contains 15 essential micronutrients. And it gets distributed in two ways. One, through the marketplace at a normal price that you and I can afford. And secondly, through BRAC. And the cost of it is $1 a month supply. And the child will receive 50% of the required daily diet. For $1, we can be saving lives of millions. This is a game changer. And it's a sustainable business model that reaches sustainability over 5 years.
So by providing it at low cost to children in poor families, you're sort of in a way leveling the playing field, that
yes.
they get a good start on life.
Absolutely. And BRAC has 60,000 healthcare volunteers. These are women from the village, trained, and have a trust with that local community. And they earn an income from it. Because when, I've gone visit these villages and I say, she's carrying a bag. I say, empty the bag out. And in that bag is everything from condoms to sanitary pads to, I say, how do you explain to men about using condoms? He says, well, I'll just tell them the truth. And, it's about saving lives. When we have built that ownership of the choices mothers have to make, the mother always makes the right choice. And that's why we have to go beyond seeing the poor as victims. This is our problem in conferences like this, is that the poor are not victims. In fact, they're the most resilient people, often supporting entire families on less than $1 or $2 a day.
Yeah. So, Carolyn, in UNICEF, we recognize, much as we have heard today, that early childhood development requires investments in health, in nutrition, in preschool education. But within countries, these are all different sectors. How do you work across sectors at the country level in order to make investments in early childhood really happen?
Well, I think you're right. I've visited lots of countries. I've never met a health child or an education child or a livelihoods child. They're children, and they have needs, and all of those needs kind of come together. So I think for early childhood, it is really important to work holistically and to look at how you do that. And we have a great example in Malawi, and I'll talk for the president, so she's not here. But we work with...
She's just come.
She's here. Perfect timing. Perfect timing. Hello, President. In Malawi, we actually work with the Minister of Health, the Minister of Finance, the Minister of Interior, the Minister of Women and Children, and we look at a very holistic program where we are doing early childhood development in schools, in preschools, and also looking at health needs of kids at the same time, nutrition needs, also looking at the psychosocial needs of kids, so where kids have been particularly affected by HIV/AIDS. So really looking at this in a holistic way, and that has proved to be extremely successful. And obviously with the president and other leadership in Malawi, it's really making a big difference. They're big investors in this early childhood idea. But it really is important, I think, to look at this issue holistically. The other point I wanted to pick up very briefly was what Jay said about mothers. And the people who are going to make the difference for kids, particularly at these very young ages, is of course their mothers. I mean, those are the people who are actually going to make these decisions and these choices. So working with mothers, empowering moms to be able to make those choices, have the resources, know where to go, have the empowered education that they know what the choices are that they should be making for their children is incredibly important, because it's actually moms. All of us are here because of our mothers, and all of us are successful because of the things that our moms did when we were little. And so it's really important to really involve mothers in those centers, in the interventions, really giving them the tools that are going to make the difference for young kids.
Thanks for that. Welcome, President Banda. Thank you for joining us. I'm glad you could make it. President Banda of Malawi. And I want to say how impressive it is to see the striking success that Malawi has had in reducing the rate of child mortality. But perhaps more impressive is the fact that the government has, in fact, invested in childcare for children between 3 to 5. And I was sort of intrigued by that. What does it take to make a political argument for investments in childcare in Malawi? How did you create the case for it?
I think first for us, let me say that I look at a child as a special gift, and that our children need special love and special protection and care. And it is to look at the situation of the child in Malawi now. And I think that is what made the argument for us. The justification came from the actual situation of the child. For me, I would like to look at the poor nutrition, the poverty that affects their poor nutrition and poor health. It also for us to pay more attention to the 1.2 million orphans. 1.2 million orphans that are not getting early child education, that are maybe in abusive homes, that maybe don't have the next meal. The final category of children that worries me is the children in markets. Because the woman spends most of her time at the marketplace. The child between the ages of 0 to 3 years spend their time at the market. And most of those children, when they grow up, are the ones that are ending up in the market anyway as vendors, so they will never go to school. The lack of facilities at those centers, at those market centers for early child education is also another issue that worries me. So for me, for us to allocate funds for early child education for children was automatic because of the situation, the current situation of our children in Malawi.
Thank you. That's a powerful investment because it clearly has a long-term return. Jay, let me ask you, you mentioned public-private partnerships a little earlier, and I've also heard that GAIN is sort of fundraising in a very different way, that you are working together with venture capital funds, and that I'm curious to know how successful that has been and how that kind of an innovation, not just going to traditional donors, but working with other kinds of partners in order to fund investments in early childhood. How has that worked for GAIN?
Thanks, Geeta, but could I just divert to address President Banda? You know, you have been inspirational to us in Africa. You know, one of the first things President did when she came to be the head of the country is sell the government jet and get rid of the luxury vehicles. So, President, if I could clone you and have you, all our heads of state do the same thing, we will solve child hunger, child malnutrition, and children dying of preventable causes. And that's the challenge that faces us, because in our countries, the elephant in the room is our government. It doesn't matter how much money you can pour in from the Gates Foundation or the Clinton Golden Initiative. It's our governments that we elect that are supposed to be delivering quality health and education to us and serving the interests of the people. So let's get the priorities right. I think we need more role models like you, President. And that's our big desire. The second thing is we can provide as GAIN or any one of us tools. How can we deliver better business models? How can we deliver innovation and technology? But the real challenge has to be the ownership at a country level. And so, yes, GAIN has developed, is a hub of innovation. And so the business model to reach the 600 million people that benefit from our programs today was that people eat food, and food is not produced by governments, it's produced largely by private sector companies. So how do we incentivize them? How do we work with governments to introduce the right regulation that is able to ensure quality? And how do we make sure that people at the bottom of the pyramid have products that are affordable, accessible, nutritious, and healthy? That is our challenge. And what we've done is working with private sector companies now have taken staple foods of people, maize meal in South Africa, cooking oil in West Africa, rice in India, and made sure that those products, because large numbers of our people are now becoming urbanized, they're not growing their food, they're eating food from a marketplace. How can we make sure in the industrial process that food remains healthy? And when we talk of food security, it's not just about the quantity of food, it's about the quality of food. And so we've used innovation and working with some of these social venture capital companies, we've been able to take companies that have created the product but cannot scale it. And what we do is de-risk the product development so that the management and the shareholders don't think you're wasting money. So part of our role with companies like these funds is saying, how do we work with y'all to invest for a development return, whereas the key element of success is management, making sure you have market access, making sure you're able to market it, the social marketing of it, how do you change social behavior of people that the maize meal you eat may be yellow instead of white, but it's healthier. And a lot of people wouldn't buy it today because they feel it's bad maize meal. So changing social attitude is a critical part, and I think that's what we're trying in GAIN to work with our partners to create innovation.
If I could add to that, you mentioned that the government is the challenge, sometimes the enemy. If I could take the opposite approach in the U.S., you have an administration here in the United States that is absolutely committed to education. For the first time, you have an FCC chairman that is committed 100% to changing the way our students learn. In the U.S., we're not teaching students any worse than we've taught last 20 years, last 40 years, last 50 years. The problem is we're teaching them the same. So this administration with President Obama, the FCC Chairman Janikowski, Secretary Duncan, they understand the power of digital technology to engage students when they come to the classroom. So they've created a digital playbook. They want digital textbooks in the hands of students over the next 3 to 4 years. And if you look at the impact that it makes when students come to class, they're using technology in their daily lives. So why can't they use technology to engage in learning, number one. Number two, you look at Miami-Dade, right? Because education, just as you said, technology is a great equalizer. In education, Miami-Dade, fourth largest district in the country, okay? Minority majority, 90% minority, over 70% poverty. But you have a leader in Miami-Dade that basically is saying we need to give 21st century learning tools to 21st century students so they'll have 21st century careers. You'll have 5- and 6-year-old girls, boys, 2 miles from the ocean, never seen it in real time, never seen it up close and personal. But that's what high-quality digital engaging content can do. It can bring the world to these students. So the government can be a critical supporter, and I think we have that in the U.S. for the first time, and we've seen the results. Miami-Dade is now one of the highest-performing urban districts in the country.
But if you have a government here in the U.S. that is supportive, does Discovery Education work in the developing world with governments as well?
Absolutely. Again, we do that in 2 ways. With Discovery Education, working directly with schools and also ministries of education. We have a team of people in India this week. And if you read what happened or what was announced in India last week, they're coming up with a $35 tablet and broadband access working with a network operator as little as $1.78 a month. And where you don't have electrical access, they're trying to figure out, can they power the tablet with solar? So whether it's India or whether it's our education partnership, global education partnership with Chevron and again, Coca-Cola, it's bringing the power of technology to communities, and it's solving not only the educational problems, formalized education, but those education learning centers that they build in 16 countries become community centers. Mm-hmm. And so whether it's prevention and treatment of malaria in Uganda, whether it's agricultural training in Kenya, or nutrition knowledge to parents and educators in Venezuela. So working with governments is absolutely critical.
This is, the power of CGI is having representatives from government, the private sector, civil society, all present together. And so here's President Banda, here's Discovery Education. I want to ask you, President Banda, are they in your plans, in your vision for Malawi, is technology, greater access to technology and the use of SMS Are you looking to that as a way to expand educational access for poor children?
Yes, right now I think I can say maybe 70% of the people don't even have access to ICT. Therefore, it's a far-fetched dream, but it is a wish and it is a hope for us as a country to be able to access our children at the earliest possible time to access ICT. We need to know some of these programs. We don't have access to some of the programs that are being cited here.
So you are, the audience here consists of leaders from the technology field, I'm sure, many, as well as from other parts of the private sector.
In fact, I'm making an appeal.
What is your request to them?
I'm making a request. I'm making an appeal that most countries in Africa, the children are lagging behind. They don't have access to ICT at the earliest possible time. And that is going to have an impact later on in life. Yeah.
Okay, so the panel was supposed to discuss why investments in the early years is an irresistible investment. And I'm just curious to give each of you a chance to say a little about that. Why do you think it's an irresistible investment for discovery education?
Well, if you don't start at the earliest years, then you're playing catch-up. And it's harder for these kids. These kids, when they come to school, they need to be ready to learn. And if they're not ready to learn by the time they get there, then you've got intervention, and they're always going to be playing catch-up. And the challenge is, it isn't that they don't know how to learn, right? It's they've never been exposed to what they needed to learn, or the teachers didn't know what to teach, or there wasn't a formalized or high-quality preschool center, or the parents didn't have the resources. So if you don't start at the earliest age, then you're going to have problems, and we all know at early childhood development years for education, that's going to be a primer, and that's going to be a model to drive their success. Education success, economic success, and then also whether they're meaningful contributors to society. We've seen with STEM education, if you don't get kids excited before they get to middle school in science, technology, engineering, math, you've lost them. And it's an important aspect for economic growth because you have a job skill gap. In the U.S. alone, we've got almost 9% unemployment. But what's shocking and embarrassing is there's over 3 million jobs that are still open in the U.S. right now. But people don't have the skills to compete and apply for those positions. And those jobs are going to grow at an exponentially faster rate than non-STEM related jobs. So we've got to engage our kids and get them excited about these areas, again, to prepare them for 21st century skills. So it's economically important. It's important for the GDP. It's important for, again, being a meaningful contributor to society. Because if there's an engineer in a village and they can figure out being exposed to science and technology and math early years, then maybe they can be somebody that can figure out how to provide clean water to that village. And then that's scalable to other villages.
How about you, Carolyn?
Well, I think for me, I would start obviously with the moral argument, and I think it's absolutely the right thing to do. We have to help young children be able to survive and thrive and live and learn. But I think the most compelling part of the argument for me goes back to impact. So if what we're doing is trying to make sure that kids are successful in primary school, for example, there is lots and lots of data that says if you want children to be successful in primary school, you need to start before primary school. And it's a proven fact that if we get kids into preschool, they will get through primary school and they will get through with the education that they need to be successful. So from a development standpoint, it's the thing we have to do. And if we want kids to be successful in school, they obviously have to survive. And if we want kids to survive, we have to focus on those early years. We have to make sure that in those first 1,000 days that kids get the nutrition they need so that their brains are developed in a way that they can live and learn and thrive and really contribute to that country's future. So to me, it goes back to the argument of why we're all doing development and what it is we're trying to have happen with all the partnerships we have and all the tools that we have. But investing in those early years is, the most critical investment I think we can make.
Would you agree, Jay?
Yes, Geeta, and I'm looking at the question there, and it's from Christine, and she says, Jay, in the first 1,000 days, are critical to health. We know what the problem is. How do we finance the solution? That's on Twitter. I have great respect as a previous Minister of Communication of social media. And, it takes me back to, I spent a decade of my life working closely with Nelson Mandela. And he once said to me, the real test of leadership is not just to tell your audience what they want to hear, but also what they don't want to hear. And, I'm thinking about that. What will it cost to save the lives of 20,000 children a day that today die of preventable causes? Measles, pneumonia, diarrhea, malnutrition. What will it cost? And if you really had to ask yourself the question, will it cost the trillions that went into saving the banking sector? No. The financing has been done. And the second thing he said to us is that, remember, in humanity, in a country like South Africa, more important than all the gold and the diamonds and the platinum and the rhodium is our children, because they represent the future. And if you want to make an investment with the biggest development return, then invest in your children as parents, as policymakers, as politicians, as corporates. And I've been in the social movements, I've been in government, I've been in business, I'm back to now doing the type of things that I'm doing now. And even if you are a hard-nosed business person, you operate in an ecosystem where you know that social stability, educated people, particularly as we progress as a result of technology into a knowledge economy, educated young people that can develop to their full potential will make you more competitive as a company, as a community, as a country, as the world. So there cannot be anything more important than investing in our children. And it costs so little.
Thank you for that. Thank you. President Banda, just as Jay said earlier, you're an inspiration because of I think what was really powerful about what you said earlier is that you recognize children not as numbers, but as individuals, and that each child's life is worth an investment in order to ensure that they have a future. Has that been something that has been an easy message to communicate to the others in government? Is there any opposition to that thought and idea? Or is this something that you have been able to move forward on with relative ease, the idea that investments in children are central for development?
I think the consensus is there across the country that it is necessary for us to invest in our children. We also agree as a nation that the first 1,000 days of a child is critical. I think the problem has been the neglect in the past. In the case of Malawi, only 30% of our children have access to early childhood education. And I would like to agree with my fellow panelists that that is a tragedy. Because in the case of Malawi, in those 30% children in accessing ECD are also accessing meals. So therefore, they have the opportunity to have a good meal. In the case of the Joyce Banda Foundation, we have 10,000 children every day, providing ECD to them. But with the help of New Skin out of Utah, we also are able to feed those 10,000 children. Most of those being orphans, they are assured of one decent meal a day. But as my colleagues have said, the problem is that their brain is also being developed at that particular time. So Africa has to make a choice what kind of generation they want in the future, because a lot will depend on how we take care of our children in the first 1,000 days.
That's really a powerful statement, because I think we don't quite realize how children who don't receive those investments in the first 1,000 days struggle then to keep up and can never quite catch up. So it's a powerful call for action. Would you like to issue a call to action to our audience here? Are there specific things that you think we have civil society representatives and representatives from the private sector and government? Is there any specific ask you have as panelists to them on this issue? I'll make mine at the end.
Well, I think one thing we didn't talk a lot about, we mentioned it, was frontline health workers and the role that they have to play, particularly in survival. And so my ask to you would actually be to do something that's fun around frontline health workers, which is to download a song that Save the Children's actually just done with the heartbeats of children from Malawi and Guatemala. So we actually recorded the heartbeats of kids. And then we recorded a song. I didn't record the song. Actually, a band called One Republic recorded the song. And you can go to our website. You can download the song. And a portion of that goes to support frontline health workers, which is what's going to help kids survive. So that would be my ask.
How about you, Bill?
Yeah, my ask simply goes two places. One is, again, access and connectivity are critical. When you look at countries like Singapore and Korea, they're among the most broadband and wired countries in the world, but they're also leading countries in terms of educational standards. And developing countries can leapfrog other developed countries. If you think about Korea, the literacy rate in 1945 was 22%. In the late 80s, it was 93%. So developing countries can leapfrog developed countries if they have access and connectivity. So that's critical number one. And critical piece number two is, and I think the panelists have said it better than I can, it's our responsibility, every one of us in this room, to think about children. And not just our own children, but children all over the world. Because as Tom Friedman said in the book, the world is flat. Because what happens in one portion of the world affects all of us. So it's a responsibility that every one of us have. So, I would just throw a call out to everybody, every NGO, any corporation that's involved or interested and has a passion for education, developing countries, developed world countries, we would love to talk to you. Because again, that's the great thing about CGI. It encourages collaboration among its members to partner and work together to solve some of these problems.
Thank you. Jay?
Well, there's an African proverb that says you can walk fast alone or you can walk long together. And I think that's what we need. It's collaboration, partnership, and ownership by the people who we think we claim to represent. And I think that legitimacy and trust is something that we have to really rebuild in the world today.
Thank you. President Banda, any last words?
Yes, in 4 areas. One, I think Malawi, in the case of Malawi would like to have support to scale up its provision of ECD to its children, nutrition for the first 1,000 days. But the most important, as far as I'm concerned, is also the prevention of mother-to-child transmission, because we are hoping that through this, we can create an AIDS-free generation. Number 3, it's to support and strengthen households that are burdened with the task of looking after the 1.2 million orphans, because they are all within the age where they need to receive ECDs. What we have found through experience, through the Joyce Panda Foundation, is that we can take the child to an orphan day care center and provide that 1 meal a day. But when they get back home, they can end up in an abusive home. So we have had programs also that build the capacity at household level to ensure that the guardian families are able to look after the children at home through economic empowerment programs.
Thank you. Thank you very much. Thank you to all the panelists. I just had one ask from all of you. I would direct you to a website that's apromiserenewed.org, in which each of you, either as individuals, as representatives of your organization or corporation, can sign a pledge to make a commitment to end preventable child deaths once and for all, and to do all we can to invest in children when they're young so that they get the right start into adulthood. Thank you very much. You've been a wonderful audience, and thank you to all our panelists.